Welcome, everybody, to today's edition of the Self-Regional Podcast, Medically Speaking. I'm excited to have today with us Graham Sullivan. Graham is the Director of Virtual Services for Self-Regional Healthcare. We're going to be talking today about virtual services and telehealth and how telehealth is becoming more incorporated into medicine in general, what we're doing here in Greenwood and Self-Regional and the communities that we serve to grow telehealth. And the services that we're able to provide with telehealth. So super excited to have you with us today, Graham. Why don't we start by just tell us a little bit about your background.
All right. Well, thank you, Dr. Logan, for allowing me to speak with you this morning and kind of expose the community to our telehealth efforts. Started at Self-Regional about 11 years ago and had an IT background working on different systems in the organization to kind of implement our Epic environment. And then really when the pandemic hit, we had a committee that was established to assess how are we going to continue care with some of the reductions in waiting rooms and the reduction in visitation. So with that group, we looked at what's the right way to access care from a technical standpoint, what's the easiest path for our patients, for our physicians, and supported that committee for about 2 years, and then was able to assume the role of Director of Virtual Services, which includes the new Self-Medical Group Virtual Services office that we opened, as well as our MyChart team. Because we really feel a big access point for our patients is using their MyChart to not only do some type of a telehealth experience, but also, request an appointment, message their provider. So we're really, from a virtual standpoint, hoping to grow the MyChart integration along with telehealth. So we were able to establish the virtual services department.
Well, I know you've done a lot of good work, and I know the pandemic kind of forced us into the telehealth world. We honestly, we're probably a little slow maybe to adopt at Self-Regional, say 3 or 4 years ago, and then the pandemic hit, and we all of a sudden had to figure it out. So thank you and the team that you work with for really helping us work through that. We dramatically increased the number, as you know, the number of televisits that we did during the pandemic, and it really just made a big difference for the community to have that as an option. So I just want to first thank you for the work that you and the team have done. So why don't we just kind of start at a high level? Why don't you just kind of tell us a little bit about maybe the history of telehealth and virtual care and how it's used here and in other places?
Okay. Well, recently I was doing some reading and saw it was an article by Thomas Nesbitt, and he wrote, "What's the evolution of telehealth?" And it was interesting to see that, telehealth comes in a lot of different fashions, and virtual care and telehealth can kind of be parallel. And in his article, he referenced, when ships had a medical emergency, they would use a physician through radio to coach, the person on the ship on how to take care of the patient. And that was around the 1920s. And then also he referenced, in some of these small Alaskan villages, they would hand out some training and some medical utensils to certain folks who would do some scoping and then relay that messaging to a specialist in a larger village to say, hey, is this patient a candidate for your care? Which I thought was really cool, where it doesn't have to be just a video experience. It's really any interaction with a medical provider, not necessarily in person. And with that, we've seen kind of the traditional models, which is, how do I get access to care if I can't get to that in-person visit? Or, and some of that could be, is it a distance issue? Is it transportation? Is it mobility? And I really applaud our medical staff at Self-Regional, because they've seen that opportunity with our patients, not necessarily as just a way to treat during COVID, but now moving forward with our patients that'll say, hey, that's a 2-hour drive for me to come and do that post-op follow-up. Or, my wife's working till 5. We have one car. I think my only opportunity is to go to the emergency room at night. I'd really like to see my primary care physician. How can we do this? Well, let's host a virtual, video call so that we can move forward with that care and keep you out of the ER. So it's really come in a lot of different forms, and it's continuing to evolve from, say, that, very primitive, maybe just a phone call for a care consult, to now we've got the video interaction, and we've even are working towards, remote patient monitoring, so we can really manage that care from home, and then also have the episodic kind of video experiences. But in general, it's just continuing to recognize that patients they're busy. They've got busy lives. So sometimes it's just convenience. Hey, I can step out of work for 5 minutes. or 10 minutes at home to have this video session with my provider, or it's as integrated as, hey, we really want to manage your care to prevent something from happening with some of that in-home monitoring, which we're looking ahead at trying to stand up some of those systems.
So I know there's several different types of like virtual visit options, for example, and I know that one of the big areas y'all are working on is like kind of almost like an urgent care type system. But then there's also other areas where it's being used in some of our practices, like say neurosurgery or in our behavioral health, outpatient behavioral health options. Can you kind of talk to us a little bit about like I guess specifically like what services we're providing right now and what you see as it potentially growing into in the future here?
Okay. So certainly our primary care physicians continue to lead, I would say the pack with offering virtual care. And we certainly have different ways that they're doing that. Most of our patients are having that video experience with their primary care physician through their MyChart. But then we also have Dr. Baruch and his team over on behavioral health. They have a mix of treating patients remotely or even patients coming into their office and having an experience either in the hospital or the office with a physician that's offsite, so they can keep that care model. Dr. Law he's done a phenomenal job with, helping these patients post-operative who they may have still a little bit of pain and some things where it makes sense to have that follow-up virtually. I've seen some really cool experiences where he's coached a patient through a wound dressing, and that patient had just applauded him for not having to make that trip to see him, where he got that same level of care in their home.
Nice.
And so we've got the behavioral health, we have neurosurgery, certainly primary care. We've got some other specialists who are considering virtual care as they've had some patients ask for that, depending on if they've got a compromised immune system and just don't want to come out to a healthcare facility or just to go out in general. And then recently we opened our self-medical group virtual services department. And that department opened mid-June, June 13th. And the goal of that is to open up access to care for sick visits. So we recognize in the community, we still have opportunities for patients to find a medical home. We have people constantly moving to the area. And we also have patients that they just want to see a sick visit when they get sick. They may not have a need for more of that regular type care. So with our self-medical group virtual services department, we're open 7 days a week, 8 a.m. until 6:30. And our patients come through our MyChart, and we've got nurse practitioners who are waiting to respond to them within 5 minutes if they want an on-demand visit, or they can schedule an appointment up to 2 days in advance. And with that, it is just like an evaluation of management if they were in person. So we start with that virtual experience, and then from there, if something comes out where the patient says, hey, let's move to a point of care test, like for a respiratory illness, we use our drive-through services that are adjacent to us. We schedule, register that patient, and they just simply come through and get swabbed or, provide that lab specimen. Because with that office, we're really working on, hey, I just don't know any other place to go, or it's a big challenge to get to an urgent care or somewhere else. So we can, again, do that at home, or it's, I just want something really fast. And from there, we want to make sure that we can start virtual. If we need to take you on site to suture a wound or give an injection or get testing, we can do that too, so that all that care is taken care of very conveniently.
That's awesome. Yeah, so I'll just give one example of a family friend of mine and my wife's. Recently had like a cellulitis on her arm, and she reached out to me and it's like, do I need to go to the emergency department with this? I'm not sure what to do. And thinking of the virtual services option, I said, well, why don't we try this? And I encouraged her just to pull out her MyChart. It's super easy. Just pull out your MyChart and scroll to like virtual visit. And clicked on that, and I said, well, just let me know how the visit goes. And she called me back about 20 minutes later, and she said it was awesome. And she was raving about how easy it was. And an antibiotic was called in. She just went directly from her home to pick up the antibiotic, didn't have to go into the office or do any of that, just cut out all those steps. Saved her a lot of time, was able to get back to work quicker, and it was great. And also got follow-up the following day, too, to check on her to see how she was doing. So kudos to your team, just from a personal experience and a family friend of ours who went through your services. And with that said, again, that was kind of the experience that I just shared that a friend of mine had. What would be the way for someone if, let's say they have kind of a minor some condition going on. Are there different options? Is it always a video visit like what my friend had, or what are the other options for those like e-visits, if we'll call them that?
And that's a really good point. So we even have patients that, I mean, they would rather just, simply submit kind of a questionnaire of their symptoms and receive, a treatment plan at another, later time in the day, or in some capacity. They just don't even have time to get on that video experience. So we have also e-visits, which the patient goes in their MyChart. You see the e-visit heading, it's right there under menu. And there's about 10 questionnaires in there that cascade between different kind of top illnesses that we see, the cough, the headache, things like that. And the patient enters that e-visit and they simply answer the questions, and it kind of asks, it gets a little more specific based on the chief complaint. After that's submitted, it goes straight to our providers. They review it and will respond back with a question in MyChart, or they'll call the patient depending on the timeline of response. And then hopefully the next step is just getting that medicine or that over-the-counter recommendation, or whatever that care treatment is. And what we've seen is with our video visits, those are compensated. They go out to our insurance, to our patient's insurance, our payers, and we're continuing to watch, the policy development with telehealth. But in general, most are reimbursing similar to an office visit. But with the e-visit, it's just $20 cash payment. So once you submit your e-visit, you electronically pay the $20, and then that goes to our provider and they review it. If we're not able to find, if based on the information we're not able to treat, we refund that $20. Same thing with our virtual. And we've really seen a good volume of patients who have used that experience. And when I do some patient satisfaction calls and follow up with them, they'll say, this was great. It wasn't really super quick as far as when I needed care, but I loved I could just do it when I wanted to. I sent it in. And when I got, for a particular patient I was talking to, whenever I took a break for lunch, I had all my information in there, and my next step was to go to the pharmacy. And the questionnaire took me, maybe couple minutes to fill out. So we're still definitely learning on the patient's kind of consumerism. Do they really want the video experience or just the quick e-visit? But we've seen a good utilization of both of those solutions in our community.
Cool. So it sounds like there's basically two big options for someone who's seeking, like you have an acute problem that you're concerned about. So you can either fill out a questionnaire, it gets sent in, or you can do a video visit. The questionnaire gets sent in, you get follow-up, and perhaps an antibiotic or whatever treatment that may be recommended based on the answers to the questions, or you can do an in-person video, or not in-person, well, I guess live video visit with a provider right then. So that's neat. One of the things I think is really cool about what you guys are doing and set up over there is it's, when we were talking about telehealth, it's like, well, a lot of times, like, boy, I really kind of would like to have a strep throat swab, or someone's having, say, urine symptoms or hurts when they pee or whatever, and you're like, well, boy, it'd be really nice to have a urinalysis. How do you do virtual visit without having test results? And you've touched on this already for a little bit. I just wanted to maybe reemphasize that a little bit. So you can do testing, and you can come directly through the drive-through services area right here itself beside the hospital and have those tests collected. Tell me a little bit about how that process works from ordering into test results, and what someone could expect for like that total time to get the results back and get some follow-up.
Okay. I'm glad you asked the question. We can expand on our drive-through services department is just phenomenal. And they're continuing to evolve and look for ways to make the patient experience more convenient. I'll just use an example. We saw a little bit of uptick in flu last week. Last Friday, it was very busy, and it was patient after patient after patient were coming in with the same symptoms, and they all kind of lived around the same area. So we kind of started putting the dots together and realized, whoa, the flu's kind of jumping out there. So we start with the virtual visit, go through those symptoms, and for those patients, they needed a flu swab. So what we do is we go into the drive-through services department. We schedule that as we're talking to the patient. Which time works for you? Most of them will say, hey, I'd like to get it as soon as I can. So just depending on, the schedule, usually we can have a patient get swabbed in as soon as 30 minutes after our visit. Could be shorter depending on what's open on the drive-through services schedule. But one particular patient, as soon as we had finished the encounter, they were parked at the front of the drive-through line. So as soon as we hit sign order, we had about a minute to get them scheduled, and the drive-through services team did a great job as we partnered. And really, they just went through and swabbed because we're taking care of that scheduling and registration step from our department before they get there. And then from time to take swab into the building, run the point of care test, around 20, 25 minutes. So altogether, patient had a 5 to 8 minute visit with us. They went through the drive-through, got the results in, say, 25 minutes. So really, within about a 30-minute experience, they talked to a provider, had their flu, and then we already had the letter to them for school, that they were flu positive, and that, of course, they needed that for the exemption at school. So the patient and their family were really, really pleased with the quickness of it. And the child was indicating, oh, do I have to go sit in a waiting room? I don't feel good. And it was really cool to see that we were able to get them through that quickly. So we start virtually, and then we order those point of care tests. And right now we are testing for strep, RSV, flu, COVID, and to your point, we have a lot of urinary infections that come through, and we'll do the same process, and they'll provide the specimen in our building. It's right off the end of the drive-through line. And then if we have a patient that we start virtually and it's just a little more complex, or something comes out that we just weren't originally aware of, we do have multiple exam rooms. So we, from time to time, will bring a patient on site if we need to do a little more scoping in the ear, or if a physical exam is really required, or in in some situations where we'll do like a steroid injection or suture a really minor wound. Because our goal is, if these patients feel like their only opportunity for some of those things is just to go to the ER, we really want to try to capture that experience first if we can, to help with some of those acuity patients in the ER.
Well, that brings up a good thought. So maybe we could talk briefly, and you've already touched on it, like what are the types of conditions or symptoms that patients have that would be appropriate for a virtual care visit or an e-visit, versus like what should, like, oh no, you really should go to the ER and not even bother with virtual visits. Can you talk about that a little bit?
Well, that's a great point, because certainly we'll have some folks that will kind of arrive in the virtual queue. They'll request an appointment with us, and they're a little bit more acute than really they probably should even have an on-site visit. Usually those are your sinus stroke, dehydration, if anyone's got chest pain, if major anxiety attack, things like that. We've had a handful of patients who've started virtually, and our process from there is to call the ER and say, hey, we've got patient X who is in a very acute situation. We're working with them to get transportation to the ER, or we've called EMS to come assist. Luckily, very few, but generally it's those sicknesses or those chief complaints that are going to need more in-depth care. And then I would say probably 99% of the patients that we've received in the self-medical group virtual services, fortunately, we've been able to treat, or we've brought them on site to take care of it. But for the few that have been pretty emergent, it's been a little bit of an interesting situation to get them that care from home if they didn't have a loved one, et cetera. But really feel like our strong partnership with the ER and with those providers to kind of give that insight, hey, they're coming, that process further makes that a better experience for them.
Yeah. For sure. So yeah, certainly. So things like severe chest pain, stroke-like symptoms where something's not working right, high fever with confusion or things like that would kind of maybe indicate something more severe. Sounds like they probably shouldn't start with virtual care, but if they ended up there, then we have a good plan in place to get them where they need to go to get acute treatment. So that's awesome. Well, good. I think I've kind of covered like the highlights a little bit. I guess on one other note on the, we talked about behavioral health, mental health options, as well as what we're doing in neurosurgery. That's not something that necessarily every patient could just access the neurosurgery via virtual health without going through their practice. Well, let's talk about, so we talked about the acute visit. What about, how are we using virtual care services in our practices right now? And I know you've touched on it some, but let's talk about that a little bit more. And then where do you see virtual services going into the future at Self-Regional?
Okay. I think really what we see in the primary care areas, when I've been able to, when they've been great to allow me to observe and talking with some of the self-medical group leadership, is, it could be as simple as patient was COVID positive and they wanted to do the follow-up with them because they had more chronic illnesses. And of course, we didn't want to bring that patient on site if they're still symptomatic, still testing positive. We see a lot of the patients that they may have a controlled substance like a ADHD medicine that by the regulation, you need to have that face-to-face visit within, say, 90 days or 60 days, having that virtually, especially we've got a lot of students who went back to school, and they're at a distance, and that's missing class, et cetera, if they've got to travel all the way back. It's a lot of the chronic care management is also where if that patient's diabetic and if there's something going on, that they need some of that tracking, again, they can't get to the office. Primary care has been awesome to extend an opportunity for a virtual visit. So they're really, I think, using a plethora of patient types to make sure that access to care continues around some of those patient-specific situations. But in general, I think we certainly have patients that ask that. They'll say, "Hey, a recent poll I was reading from a Forbes magazine from Prosper Analytics and Insights indicated that 36% of adults had a virtual visit during the pandemic." So I think now we've got patients who are kind of aware of, "Hey, I can do this. This worked great before." So I think they're getting a lot of requests from patients that'll say, "Can we just do this virtually?" And I think depending on probably the provider's kind of judgment on is that the right thing from some of their protocols, they'll do that virtually. But from what I've seen just in general, it's usually, is there a patient challenge to get into the office, or is it a specific treatment option that can be managed virtually, like a follow-up visit or something like that, and they're using that technology to create that best patient experience.
So Graham, tell me for a second, the ages that you can take care of through the virtual services. I think some of the youngest of the children that we may not do. Tell me about that for a second.
So the population that we serve is 5 years and older.
Okay.
And then of course we've had folks that have used our services that are in their 80s. So we from a 5 years and older, we felt like that was the best age to be able to have the patient really explain some of the symptoms they're having with the parent. And through that process, the patient within their MyChart, their parent will have proxy access and can schedule that youth in our office. So 5 years and older for all of our family medicine type issues is our current population.
Okay, well, good. So, one other thing, just for everyone who's listening, tell us what you have to do to access telehealth. If I know we've touched on it, but it sounds kind of complicated if you've never done it before. What do you have to access telehealth? I believe just a cell phone or a computer access. So walk us through the steps. So let's say I'm at home and I have a condition and I want to access telehealth services. What do I do?
So having connectivity to really cellular or the internet is really the basic foundation of it. So we're working to continue to assess what is how do we get to a more, I would say, appropriate tool that is the most convenient for our providers and for our patients. But most of our patients, we work, and as just in general in our community, we're really working hard to expand our MyChart activation, because we've got not only the ability to do virtual care, but a lot of the great patient engagement tools, messaging the provider, seeing your lab results, seeing your physician's note. So really trying to leverage that to expand MyChart. But for most of our virtual opportunities, you simply having MyChart and then the practice scheduling you for that visit, and then onboarding into what that experience is going to be, those instructions. And then with that, our patients do an e-check-in. So what that experience is our patients basically confirm their insurance, their some of their clinical questions. Are you still, taking that medicine? Or do you still have that problem? Do you still have that allergy? And then there's some specific, questionnaires depending on if they're Medicare, et cetera. And then they simply join the video, and they can do it from their cell phone or from their laptop. We've seen all kinds of interesting scenarios. A lot of people driving, and we'll say, "Hey, please drive, please pull over." People out, on vacation, people that are out by their pool. And then we have, of course, folks that are, on their sofa or in their living room, in their office. So we've really seen a cool blend of how the patients are using whatever technology they have to access that care. But in general, most folks use their smartphone or their computer. And I realized that I need to go back to that previous question of where is telehealth kind of going forward. Yeah. And I think a lot of that's going to be that investment in our MyChart expansion, and having just more awareness of that tool, and continuing to support our medical providers with enhancements to those tools, so that they can continue to be as efficient as we can with our virtual tools, as well as how do we take not only the video experience, but more of that patient monitoring experience and more of that management of care outside of episodic care, which I think is going to be that investment in more data tracking and working with our home health, folks, as we really help a lot of these chronic care patients stay out of the hospital and hopefully avoid an acute episode because we caught it on the front end.
Sure. Yeah, and you just mentioned MyChart. I think it's important people know how easy that is. So it literally is just say on your phone, going to the App Store and looking for MyChart and downloading that app onto your phone. And then when you click on that the first time, it walks you through a registration process. You choose self-regional healthcare. You really just put in your date of birth, your name, those type things, and it automatically will pull up any records that you have and pull it right in there. I helped my parents with it recently, and I was kind of surprised how easy it was. And my parents are in their 70s, and within probably about 5 minutes, I had them up and going on MyChart, really just downloading the app on the phone, and I showed them where the virtual visits are. It's just, you just scroll right down, and it's right there. Just tap it, virtual visit, and it takes you right to the virtual visit. And it's really become very easy for folks. The other really cool thing about MyChart is instant access to your lab results, pathology results, x-ray reports, office notes, those type things, which are just auto-populated in there. And you get a little ding on your phone when those tests are back, and you can see it. And it's helpful, and I think it's really getting patients more engaged with their care. And sometimes labs may be a little confusing to someone if they haven't looked at them before, or maybe not understand like what they mean. As you know, we're required by federal law under the Cures Act to instantly give them to them as soon as we need to. But we just ask everybody if you're not sure, talk to your doctor about what that means, because sometimes something might look real scary, but really it's really not that big of a deal or really clinically significant at all. So always talk to your doctor as something comes back on there and you're not sure what it is. But I just wanted to point out how easy it is to get MyChart. And that's one of our big goals for this year at the hospital, as you know, is to get more people on MyChart so we can get more engagement with our community. And the cool thing is it's not just getting your results back, it's about the ability to communicate with your healthcare team directly over the MyChart, where you can send a message to your provider team and they can give messages back to you, refill your medicines, do all that thing right there. So such a great tool. It opens up the virtual options for folks. As far as long-term wise, the more people we can get on our electronic medical record through the MyChart on your phone, the more access and the more convenience, and also just that engagement with your own health, I think which is going to be so important going forward. So, well, Graham, listen, thank you so much for visiting with me today. This has been real helpful for me, hopefully for our listeners. Do you have anything else that you want to add today or share with our community?
Just gonna again thank you, Dr. Logan, for allowing me to speak on our virtual services and our virtual tools, and we're really excited about continuing to hopefully grow our access to care, especially in our rural areas. And again, it's very important to sign up for MyChart. It's a great tool to stay connected in our community. You can go to mychart.selfregional.org and sign up. You can go to our virtual services, selfregional.com/virtual care. You can also find a way to sign up there or see more on our virtual services. And then we have a phone number with a team who's waiting to help with MyChart support or enrollment, and that's 864-725-2737, also on our website. Perfect. So we're really, again, excited as our organization is going to continue to try to expand MyChart and layer in telehealth along with other tools to keep that patient connected to our health system.
Awesome. Graham, we are so excited about the work you and your team are doing. And I think going forward, this just opens up so many new opportunities for our patients to be able to get convenient access, that quick turnaround service that we want to be able to provide, and really take our services up a couple levels. So listen, thank you for the work and thank you for your time today.
Thank you, Dr. Logan.
Absolutely.